Welcome to our Healthcare in Detention course. My name is Anucha Chanprasad from the International Committee of the Red Cross Health Unit Bangkok Delegation. My background is in pharmaceutical science and public health. My section is about the medication management in prison. I would like to give you an overview of the right and access to healthcare and the importance of providing healthcare to inmates, ensuring access to medication to enhance adherence and health outcomes, recommendations in medication management in prison, and the challenges in the medication management in prison. At the end of the section, I hope you can understand the medication management in prison and its limitations, and understand the importance of medication management in ensuring the continuum of care. There are four aspects related to the prisoner's right to health and the importance of the prison health. The legal aspect, as in the international human rights laws that you learned from the human rights section, so I am not going to go into details of this aspect. The ethics aspect, healthcare in prison is guided by the same ethical principle as in the community. And healthcare is also given to the prisoner for social reason too, as the vast majority of inmates will return to society within a few years. Proper care helps to preserve their physical function, which makes it possible for ex-inmates to reintegrate into society, to embark on productive activities, and avoid becoming a burden to all. The public aspect. Public health policies are meant to ensure the best possible conditions for all members of society, so that everyone can be healthy. Prisoners are often forgotten in this equation. Prisoners enter and leave prison. They are released if they found innocent. They come and go from prison during the investigation and for trial, or transferred from one prison to another. Prisoners eventually are released from prison when they have served their time. This turnover and constant movement in and out of prison makes it more important to control any contagious disease within the prison so that it does not spread into the outside community. Medication management is an essential component to patient safety to minimize error to avoid costly adverse events. It consists of 7 critical processes, as you can see in the slide, but I am not going to go to all of them. And the elements of concern in medication management are the patient center that we focuses on the patient's need and concern and involve the patient in the care process. Assessment of medication about their effectiveness, safety, adherence, accessibility, including cost of medications, and collaborative approach that involve the patient, caregiver, pharmacists, and other healthcare providers, and focus on the health outcome. Here I would like to show you the picture of the medication administration, which is different between the general community and prison setting. In general community, when you get the medicine from hospital or pharmacy, you keep your medicine at your place and you can access anytime, or we can call it in possession or self-administration. But in prison, the main way of medicine administration, which is not in possession or direct observed administration for the security issue, but some prisons adopted the in possession, which allowed the inmate to keep their medicines with them for a timely administration, but only some medicine will be allowed and after risk assessments was carried out. Now take a look at the medicine stock of healthcare provider in general community and prison clinic. For timely medication administration, the prison might consider to stock some essential medicines which depends on prison's budget. In the picture on the right, the clinic at Monrovia Central Prison, they provide free health care, but they lack of essential medicine, including staff. Now let's look at the medication administration and patient safety in prison. You might heard about the 5 rights to ensure patient safety in medication administration, but as it is about the patient safety, so healthcare provider added more components to ensure the safety, which could be 8 or even 10 rights. As you can see in the slides, I will show you only some rights with example of what happened in prison so you can see some of the challenges in the medication management in prison. Many prescription medicines are of great value in prison economy. Also, plenty of incarcerated population have issues with the substance abuse. When illegal substances are out of reach, prescription medicines provide a way to get a fix. Others use prescription medicines to deal with the boredom and anxiety that come with being locked up. As a result, those prescription medicines could be treatable and will be potential for diversion. The diversion is the unlawful channeling of regulated pharmaceuticals from legal sources to the illicit marketplace. These include transferring medicine to people they were not prescribed for. Cheeking is a common means of diversion where the patients pretend to swallow a medication but instead holds the pill in the cheek pocket for use later. Patients skilled in sleight of hand may pretend to put pills in their mouth when really keeping them in their hand to slide into a pocket. The top desirable medicines are usually those that have a psychoactive effect or side effect, for example, the sedative effect such as trazodone or even skeletal muscle relaxant. Next one is right medicine. One of the factors associated with medication errors that happen most often is medication with the similar names or similar packaging, or what we call look-alike or sound-alike or LASA, especially when they have similar strength, which can result in medication error. And misreading of LASA is a most common medication error. Next one is right time, means that medicines were given to the patient at the right time and the right frequency. In theory, all medications available to people in the general community should also be available to prisoners. However, in practice, it may not always be the case. Security consideration and daily routines of the prison mean that some medication regimens are not effectively available. As you can see in the slide, the wrong time could be happen throughout the incarceration. At the arrival, medicine is often taken away for security consideration, and that will cause the delay or missed doses of medication. And during stay, medication rounds whereby prisoners are handed out their medications and are supervised while taking them may happen as few as 2 times each day. This has several implications. Firstly, means that the 3 and 4 times daily medication regimens are often impractical. Secondly, it makes the time various medications are taken more difficult to control. A medication that should be taken at 10 p.m. may be distributed and observed by a health professional to be taken at the 4 p.m. This effectively means that the medication must be taken according to the compromise between the medication schedule and the prison schedule. This restriction may limit the choice of medications of the prescriber, where they know it will be impractical for a medication to be taken at a particular time. For example, during admission in the hospital, the patient had the clozapine 100 mg for schizophrenia, 1 tablet at bedtime. But once being discharged from hospital and back to prison, the patient was given a clozapine in the afternoon, resulting in the patient are getting drowsiness and could not join the afternoon activity and wake up in the middle of the night and cannot get back to sleep. And upon release, if the patient is not provided enough medicine to complete the treatment, it surely affects the effectiveness of the treatment provided in incarceration. Next one is right dose, means that the medicines were given to the patient in the right amount of the medicines. And medicine has many different dosage forms for many reasons. One is controlled release, which release small amounts of medication into a person's system over a long period of time, aiming to reduce the number of the single doses per day, improving patient compliance of treatment, and to decrease the fluctuation of plasma level in order to obtain therapeutic efficacy and lower toxicity. This kind of form should not be crushed. This medicine should not be chewed either. Otherwise, the drug in the blood level cannot be controlled. The example is that a patient was prescribed sodium valproate chrono 500 milligrams to treat bipolar disorder, 2 tablets at bedtime. But once discharged from the hospital and back to prison, to prevent prescription drug abuse, the prison crushed the medicines and gave to the patient in the afternoon. The result was that the patient experienced waddle, cannot balance himself well, and having a terrible drowsiness. After the prison managed to give the right administration, the patient can continue daily activity. As you can see from the previous slides, the challenges in medication management in prison are misuse, abuse, or diversion, as some prescription medicines are tradable, practices which are not in line with the right checklist of medication administration, which affect patient safety, the budget of prison to provide the essential and critical medicines for timely use to ensure the access to medicine of inmates. From the challenges mentioned in the previous slide, next will be the recommendations in medication management in prison, which will be explained in all 3 stages of incarceration. At the time of arriving, the health screening is one of the most important practice of medication management in prison. At this point, the medication reconciliation should be started here. A medication reconciliation is a process for obtaining and documenting a complete and accurate list of a patient's current medicines upon admission and comparing this list to the prescriber admission, transfer, and/or discharge orders to identify and resolve discrepancy. And to ensure the access to medications of inmates, the prison might consider to stock a critical medicine stock aiming to maximize patients' access to medicine during initial hours following admission or to stock the urgent medications for emergency cases. There are 2 main ways of medication administration in prison, which is not in possession or direct observed medication, which found in most prisons because of security concern. It also limits the medicine misuse, abuse, or diversion as well. And in possession or self-administration is common practice in general community. This practice basically in line with the general public where patients in prison should be treated as responsible people. A large number of them are perfectly capable of taking responsibility for storing and use their medications, and in fact have been used doing so when in community. The benefit of in-possession practice is better management of long-term conditions or lower demand of staff resources. But before adopting the in-possession medicine, the risk assessment needs to be carried out by the health team or mental health team. Each patient will be assessed for their ability to manage their own medications, their ability to learn whether they have high number of prescribed medicines or having mental condition. So to manage medication during incarceration, especially patient safety in medication administration, we need to consider the right checklist in medication administration, and we might consider in-possession practice where possible, Review patients' medication regularly and effectively. To limit the drug diversion, we need to examine the oral cavity, and it is important to educate patients about the importance of medicine adherence. Before I go into the medication management upon release, I would like to talk a little bit about the medication adherence. Medication adherence is important throughout the incarceration, especially post-release, for the better health outcomes. Continuity of care is one of the most important things to achieve, and to ensure the continuity of care, improving the medication adherence is essential. There are three factors affecting the medication adherence, which is factors related to the patients. For example, the addiction, the social support, their understanding of the disease and medication benefits, access and trust in their healthcare provider and health system. Next is factors related to the healthcare provider, like the provider recognition and understanding of patients' beliefs, fears, as well as their own biases, and factors related to prison settings like the budget, prison administration system, the availability of the health services, and the security issues. And I would like to add that access to medicine is also very important to promote the medication adherence. How to ensure the access to medicines of inmates throughout the incarceration, including post-release, is very important to achieve the better health outcome. Discharge plan is very important to ensure the continuity of care. So, to plan the discharge, we should take into consideration of the components of the continuity of care, which are health coverage or health insurance is a key ingredient of access to quality care. It can help lower healthcare costs, hospitalization, and emergency department visits, as well as decreased mortality and also recidivism for justice-involved individuals. Maintaining medications. The continuation of medications can be critical to preventing relapse and other adverse outcomes. So to help ensure that there's no gap or drop off after release, the patient should be provided a short supply of medication, usually 14 to 30 days, that can serve as a temporary bridge until patients can see a prescribing provider in the community. Linking to providers. Ultimately, health coverage and temporary medication supplies are off-limits use if the individuals do not connect with the necessary providers. So states work to form such linkages in various ways, including providing referrals, scheduling appointments, and facilitating opportunities for doctors to communicate with their filter patients before release. Record sharing, like medical histories, diagnoses, current medications, and laboratory test results that can help save time and money and prevent the delay or disruption of successful treatment plans. Some states routinely hand over records to individuals leaving prison or to their community provider. Privacy and consent is the most important thing to keep in mind, or at least patients are given written information about their medications, so is also used to inform their ongoing medicines needs. Patient education. Everyone plays a large role in managing their own health. It's important to equip individuals with skills to successfully manage their conditions by offering general education opportunities before release. For example, hold a one-to-one discussion with the patients to agree a plan for how they will take medicine after they are released from prison. This should include education about taking prescribed medication. It is also important to consider carrying out a medication review for patients who are assessed as needing extra support for manage their medications on release or transfer from prison, which are patients with tuberculosis, HIV, diabetes, or mental health problems, patients with neurodevelopmental disorders like learning disability, patients receiving end-of-life care, older patients, or patients serving long-term sentences. I would like to end my presentation with the often repeated statement by British penologist and the Prison Commissioner Sir Alexander Patterson. Prisoners are sent to prison as punishment, not for punishment. If you are interested to learn more, please follow the reference I put here at the last section of my PowerPoint. And thank you so much for your attention. And if you have any question, please feel free to reach to my email.